Her daughter's insurance was denied, so the hospital turned her away. Hours later, she died gasping for air in the same ER that refused to treat her. Welcome back, and thank you for listening. I'm just a small storyteller, so if this touched you, please hit that subscribe button for more heartwarming stories like this. Let me know in the comments where and what time you're listening from. I read them all. Now let's hear the story. Vanessa Fields was used to keeping her head down. She had learned a long time ago that raising your voice, especially as a black woman, only made people look at you like you were the problem. So she kept her voice even, her smile soft, and her needs small. At 40 years old, she worked quietly as a home health aide, taking care of strangers while barely keeping herself afloat. 2 jobs, 12-hour shifts, sore knees, and a back that cracked every time she sat still too long. But she never complained. Not really, because she had a purpose. Her daughter, Maya, was everything. Smart, soft-spoken, sharp as a blade when it came to science and books. At 22, she had dreams of med school and had just been accepted into a competitive pre-med track at UNLV. Vanessa had raised her alone from the time she was barely more than a child herself. 18, scared, and working part-time at a strip mall hair salon when she first held Maya in her arms. She didn't have much, but she'd always told Maya, "You go further than me, baby. You go all the way." So she picked up extra shifts, skipped meals, delayed her own doctor visits, just so Maya could have bus fare, books, and maybe a little dignity. But lately, something had been off. It started subtle. Maya came home more tired than usual. Said her chest felt tight, sometimes after walking between classes. Her legs got sore too quickly. Vanessa had watched her closely, asked if she was eating, resting, stressed. Maya brushed it off like always. "It's nothing, Ma. Probably just from staying up too late." But mothers know. Vanessa knew. So she insisted they go to the clinic near their apartment, the kind with plastic chairs and peeling paint, and the kind of nurses who never made eye contact unless they were asking for copays. Vanessa filled out the intake form while Maya sat slumped in the corner, pale and quiet. The nurse called them in after nearly 2 hours. She glanced at Maya's vitals, asked a few rushed questions, then leaned back and sighed. "You're probably just dehydrated. Finals coming up?" Maya nodded weakly. "Yeah, classic stress response. Drink more water. Sleep. You'll be fine." Vanessa frowned. She's been dizzy for days, and she said her chest hurts when she breathes deep. That doesn't sound like just stress. The nurse raised an eyebrow, clearly annoyed. "There's no fever, no high blood pressure, no visible signs of trauma. We don't order tests unless it's clinically necessary. If it gets worse, go to the ER." Vanessa opened her mouth to push back, then closed it. She recognized the tone. She'd heard it before, at social services, at school meetings, at job interviews. It said, "You're wasting our time." They left with nothing but a paper printout of breathing exercises. Maya didn't say much on the way home. Vanessa watched her out of the corner of her eye. The way her hands trembled slightly when she tried to hold her phone, how her shoulders curled inward like she was trying to disappear. Vanessa wanted to shake someone. Instead, she wrapped her arm around Maya's shoulder. That night, Maya barely touched her food. Vanessa sat across from her at the table, her spoon stirring soup that had long since gone cold. She didn't want to overreact, didn't want to scare her daughter, but something inside her, the part that had survived everything from eviction notices to loneliness, was starting to scream. The next morning, Vanessa called out of work. She didn't give a reason, just said, "Family emergency," and hung up. She packed a bag with water, snacks, a blanket, and Maya's old student insurance card. They headed to the nearest hospital ER. The lobby was full. People slumped in wheelchairs. Children crying. Phones buzzing against thighs. They waited for nearly an hour before a nurse called Maya's name. Vanessa followed her into triage. Same questions. Same dismissive tone. "Breathing issues? Are you prone to panic attacks?" "No," Maya said quietly. "History of asthma?" "No." "Any substance use we should know about?" "No." The nurse nodded and scribbled something down, then turned to Vanessa. "Look, her vitals are stable. Her oxygen's 99. These symptoms are common in young adults under stress. Without insurance, she'll be listed as self-pay. That limits what we can do unless there's a clear emergency. Vanessa's lips tightened. She can't sleep at night. She can barely walk across the room. This is a 22-year-old girl who's never had issues like this. I need you to look closer. The nurse sighed. We're doing what we can. No blood work. No imaging. No one listened when Maya tried to explain how the tightness in her chest felt like something was pressing down from the inside. After 3 hours in the waiting area, they were handed discharge papers and told to follow up with a primary care physician. Vanessa didn't have one. Not since hers retired 2 years ago, and no one nearby accepted her Medicaid plan anymore. They went home in silence. Maya fell asleep sitting upright on the couch, arms wrapped around her knees. Vanessa watched her all night, her own heartbeat refusing to slow down. The next day, she called another clinic. The woman on the phone said they could schedule Maya in 2 weeks, maybe. Vanessa said no thank you. She took Maya to a different hospital, on the other side of the city this time. Same result, different words. We can't prioritize non-emergency cases. She's young. It's probably nothing. Do you have insurance on file? By the time they reached the third hospital, Maya could barely sit upright. The woman at the intake desk asked for ID, then asked for insurance. Vanessa handed her the student card. The woman typed for a moment, then said, "This plan is inactive." Was it canceled? Vanessa blinked. She's still in school. It should be active. The woman shook her head. Sorry, it expired last semester. Without updated coverage, she'd be a cash patient. Vanessa stepped forward. She can't breathe. She's been dizzy for days. What do we have to do to get someone to look at her? The woman frowned. We're doing our best to manage resources. If she becomes non-responsive or her vitals drop, we can escalate. Until then, you can wait. But priority will go to emergency cases. Maya pulled gently on her mother's sleeve. It's okay, Ma. Let's go. Vanessa wanted to scream, to slap the desk, to demand someone do their damn job. But instead, she nodded, took Maya's hand, and led her back out into the parking lot. In the passenger seat, Maya coughed so hard she nearly vomited. Vanessa handed her a water bottle with shaking hands. She started the car. Didn't know where she was going. All she knew was that no one was listening, and her daughter was disappearing. The night after their third hospital visit, Vanessa didn't sleep. She sat at the edge of her daughter's bed, her fingers lightly brushing across Maya's forehead every few minutes to make sure it wasn't clammy. Maya had finally drifted into a shallow sleep, curled up in a ball, breathing unevenly. Every now and then she twitched, and her breath hitched like she was choking on air that wouldn't go down. Vanessa watched her chest rise and fall until sunrise. By morning, Maya couldn't even sit up without going lightheaded. Vanessa tried to help her to the bathroom, but halfway there Maya had to lean against the wall, panting, whispering, "I feel like I'm going to pass out." Vanessa helped her back to bed and called another hospital, St. Rose Dominican, across town. She didn't care about distance anymore. She just needed someone who would take this seriously. A woman at the front desk answered, sounded cheerful until Vanessa mentioned that Maya didn't have active insurance. "I'm sorry, ma'am, but we're not a public facility. If it's a non-emergency and she's uninsured, she need to register for financial assistance first. Or go through the ER, but there may be a wait. She's dizzy, she's weak, she can't breathe right," Vanessa said, trying to keep her voice level. "If she's in immediate danger, please call 911, the woman replied, then transferred her to a pre-recorded message about charity care. Vanessa hung up. By noon, Maya was vomiting. She tried to act calm, like it wasn't that bad. Wiped her mouth with the back of her hand, said, "It's probably just from not eating." Vanessa saw through it. The girl was gray around the lips and cold to the touch. They got into the car again. This time, Vanessa didn't say where they were going. She drove to North Vista Hospital, hoping, just hoping, that someone would listen. Maya barely made it inside the lobby before she collapsed into a chair. Her legs couldn't hold her. She slumped to the side, clutching her stomach and gasping for air. A nurse noticed and rushed over. But when the woman behind the glass checked the computer and saw Maya's status marked self-pay, everything slowed down. Vitals are within range. "We can place her in the queue," the nurse said carefully. "We're severely understaffed today. It might be a few hours." "She can't sit upright," Vanessa said, her voice rising. She hasn't eaten in 2 days. She's losing weight. She's pale. She can rest here. We'll monitor her." Vanessa turned to Maya. "Baby, hold on. Just hold on." Maya nodded weakly, her eyes glassy. I'm okay. But she wasn't. They waited 2.5 hours. When Maya was finally called in, she had a brief consult with a physician assistant who took one look at her, reviewed the basic triage notes, and said it again. Young people, especially students, tend to have psychosomatic symptoms under high stress. We're seeing a lot of that lately. Vanessa clenched her fists. "You're saying she's making it up?" "No, ma'am. I'm saying the mind and body can mirror each other. She's not in acute danger. Her pulse is steady. There's no fever. If she had insurance, we could run tests, sure. But from a clinical standpoint," Vanessa stood up. "I've taken her to 3 hospitals. 3. Every single one says the same thing. What do I have to do? Let her die in your lobby before someone checks her properly." The PA held up his hands, calm and composed. "If her condition deteriorates, we'll reassess." But they didn't. They were sent home with instructions to rest, hydrate, and consider speaking to a counselor about possible anxiety. That night, Maya had a seizure. It started small. Her hand shook while she tried to sip from a glass. The glass slipped, shattered on the kitchen floor. Vanessa turned just in time to catch her before she hit the linoleum. Maya's eyes rolled back. Her body went stiff and jerky. Vanessa screamed her name, held her head, and called 911 with trembling fingers. The paramedics arrived within 10 minutes. Maya was awake by then, alert but weak. She sat slumped against the fridge, sweat pouring down her neck, breathing fast but coherent. Vanessa begged them to take her anyway. The EMT asked for her ID and insurance card. Vanessa handed over Maya's expired student health plan. The EMT scanned it with a tablet, then frowned. "This isn't active. Do you have emergency Medicaid?" Vanessa shook her head. "We applied. Still waiting." The EMT nodded without emotion. "Vitals are stable now. Pupils responsive. No loss of consciousness lasting longer than a minute. Based on protocol, this doesn't qualify as a life-threatening event. She can be taken in for evaluation, but you'd be responsible for the transport and full ER bill unless coverage is confirmed." Vanessa looked at her daughter, sitting in her pajamas, shivering, wiping tears from her eyes like she was ashamed of being sick. "Is there anything you can do?" she asked. "We could do a full workup in the ambulance. If her vitals drop or she seizes again, we transport immediately." They took readings. Maya's oxygen was at 95. Her heart rate was slightly elevated. No fever. No crash. After 20 minutes of monitoring, they packed up and left. "She's not emergent," they said. Vanessa didn't sleep again that night. She dragged a mattress into the living room and lay beside Maya on the floor, held her hand until dawn. Maya slept restlessly, her body twitching every so often. Vanessa stared at the ceiling, trying not to cry. Her baby was 22. Too young for this. Too young to be dying quietly in a living room while people in scrubs wrote her off as a dramatist. In the morning, she called the Medicaid line again. "Your emergency coverage request is still under review. Processing times can take up to 14 business days." Vanessa hung up and screamed into her pillow. Her daughter needed help, and they were running out of places to ask. It was the 3rd day after the seizure, and Maya hadn't left the couch. Her body was there, thin and small under the blanket, but her spirit had shrunk somehow, like her body had given up on trying to be heard. Vanessa tried everything. Bone broth, warm towels, peppermint oil on her temples, the remedies her grandmother used when doctors were too far or too expensive. Maya barely reacted. When she opened her eyes, she didn't look afraid. She looked resigned. Vanessa knelt beside her on the floor. "Talk to me, baby. Anything. Are you in pain? Are you cold?" Maya blinked slowly. "It's like I can't get enough air, even when I'm not doing anything. Like my lungs forgot how to fill all the way." Vanessa closed her eyes for a second, trying to hold herself together. "Okay," she whispered. "Okay." She sat beside her daughter in silence. The air in the apartment felt heavy. The smell of Vicks and lavender couldn't cover the fact that something was very, very wrong. She looked at her phone. No new messages from Medicaid. No callback from the charity hospital. She tried every urgent care in the city, but they either didn't take walk-ins or required upfront payment. Some offered installment plans for services they refused to define over the phone. Vanessa didn't need promises. She needed help. That evening, Maya tried to get up to use the bathroom and collapsed. Her knees just gave out. Vanessa caught her under the arms, panic rising as she felt how light Maya had become. "I'm calling an ambulance," Vanessa said. Maya's head shook slowly. "We can't afford it." "I don't care." Maya didn't argue again. The 911 dispatcher was calm, clinical. Vanessa gave her address, explained the seizure 3 nights ago, the continued shortness of breath, the fall just now. The operator told her to keep Maya awake and breathing until the team arrived. 12 minutes later, 2 EMTs stepped through the door. One young Latino guy with a trimmed beard, the other a white woman with short hair and tired eyes. They checked vitals, asked questions, and began recording data into a tablet. "Pulse is fast," the woman noted. "Oxygen's at 93. Still within safe range," her partner replied. Vanessa watched as they worked through the checklist. Blood sugar, pupil reaction, respiratory rate. They kept asking questions Maya was too tired to answer. "Any known heart conditions?" "No." "History of seizures?" "No." "Insurance?" Vanessa handed over the card, knowing what was coming. The EMT scanned it. He didn't say anything, just turned the screen toward his partner and gave a nod. Vanessa stepped forward. "Is that going to be a problem?" The woman glanced up, polite but detached. "She's uninsured." "That's noted, yes. She had a seizure 3 days ago. She just collapsed again. Her oxygen is dropping. Doesn't that qualify as serious?" The woman hesitated. "We can take her in, ma'am, but I need to be clear. If she's not actively seizing or unconscious at transport and her vitals stabilize en route, she may be triaged as low priority. It may take hours before she's seen. And if I don't take her, she should follow up with a primary care physician or urgent care. She has no doctor. You people keep telling me that. Do you know what it feels like to hear that 5 times a week? She has no doctor because no one will see her without insurance." Silence. "We can take her," the woman said gently, "but you'll be billed for the ride and emergency room evaluation. Without coverage, that could be upwards of $1,000, depending on how long she's there." "I don't care about the bill," Vanessa snapped. "I care about her breathing." Still, the EMTs hesitated. The oxygen reading bumped back up to 94. Maya was sitting upright now, pale but conscious, breathing shallowly. From their perspective, it looked stable. The woman finally said, "We can transport, but unless her condition declines significantly, she'll be categorized as non-urgent." Maya looked at her mother with pleading eyes. "Ma, I don't want to go back there. They don't do anything. They just send us home. Please." Vanessa's chest tightened. She looked at the EMTs, then at her daughter. "Can you at least give her something now?" she asked. "To help her breathe? We can administer oxygen and continue monitoring, but we're limited in what we can do without transport authorization." So that's what they did. For 45 minutes, Maya sat with a nasal cannula while the EMTs filled out forms and recorded vitals. When her oxygen stabilized at 95, they packed up and left. "We suggest taking her in if anything worsens," the male EMT said before closing the door. Vanessa stood in the hallway long after they left. The silence in the apartment felt like judgment. Maya was back on the couch, her eyes closed, the oxygen tube gone, her chest rising and falling like a ticking clock. Vanessa pulled out the little black folder she kept in the drawer by the fridge. Inside was a copy of Maya's birth certificate, report cards from middle school, the one birthday card Maya's father sent before disappearing for good, old medical records, the expired insurance card, and Maya's scholarship letter. She looked at the heading on it, University of Nevada, Las Vegas. Pre-med acceptance, class of 2024. Tears hit the paper before she realized she was crying. That night, Vanessa stayed on the floor beside her daughter again, afraid to sleep. Afraid she wouldn't hear her stop breathing. She thought about taking Maya to the ER again, but she also thought about what it would do to Maya's spirit if they turned her away again. She thought about that phrase, non-urgent, and how it had started to sound like a death sentence. And for the first time since this began, she started to wonder if the system was designed to make her feel exactly this: powerless, alone, and one denial away from watching her daughter die. It was still dark when Vanessa opened her eyes. She hadn't meant to sleep, just to rest her head for a moment beside Maya on the mattress. Her neck ached, and her hand was numb from holding Maya's the entire night. But that wasn't what woke her. It was the sound, quiet, gasping like someone struggling to breathe through a straw. Maya. She turned, heart thudding. Maya's eyes were wide, lips slightly parted, her chest rising in shallow, desperate pulls. She wasn't coughing, wasn't wheezing, she just couldn't breathe. Vanessa sat up, grabbed the thermometer, the pulse oximeter, thing she'd borrowed from the care home where she worked. Maya's oxygen was at 88. Too low. Maya, stay with me. Just breathe, baby. Maya shook her head, tears forming as her hands trembled. That was it. Vanessa didn't bother calling this time. She didn't wait for permission. She wrapped Maya in a blanket, carried her to the car with shaking arms, and started driving towards Sunrise Hospital. Her lips moved in prayer. Her foot pressed hard on the gas. The hospital parking lot was half full, glowing in soft fluorescent light. Vanessa pulled up to the ER entrance and jumped out. She opened the passenger door and helped Maya onto her feet. Her daughter couldn't even stand. Vanessa burst through the glass doors, half dragging, half carrying her child. "Help!" she shouted, louder than she'd ever allowed herself to speak in public. "She can't breathe. Somebody help my baby." Heads turned. A man in scrubs at the front desk stood. A nurse walked briskly from the triage station. "Ma'am, please calm down," the nurse said, arms out as if trying to de-escalate a fight, not a crisis. "Let's take a breath, okay? What's happening?" Vanessa's voice cracked. "She can't breathe. Her oxygen's under 90. She had a seizure this week. Please, just help her." The nurse turned to another behind the glass. "Can we get a wheelchair? I'll bring her back to triage." "Ma'am, we need her insurance information." Vanessa was already reaching into her bag. "Here, this is what she had. Her student insurance. We're reapplying for Medicaid. We haven't heard back yet. Please, just see her first." The nurse took the card, eyes scanning the screen as she typed. Then she hesitated. Her eyes flicked to the corner of the monitor. "I'm sorry, this plan is inactive," she said softly. "Do you have updated insurance?" "No," Vanessa said. "I told you. We're reapplying. It's in process. Just help her." "I understand, but without active insurance." "Are you kidding me?" Vanessa stepped forward. "She's dying in front of you, and you're talking about insurance?" "Ma'am, we need you to lower your voice." No, don't you tell me that," she snapped. "Don't you dare tell me to be quiet while my daughter is suffocating." The other nurse behind the desk picked up a phone. A security officer near the entrance began walking over. Maya let out a dry, rattling cough and leaned sideways against her mother. Her eyes were unfocused. The nurse finally stepped out with a wheelchair and began checking her vitals. "Pulse is rapid. Breathing shallow," she said. "But she's responsive." A doctor passed by and looked over. The nurse whispered something to him. He walked away. Vanessa's voice broke. "Please, you need to take her back. Please just do something. She's not okay." The nurse bit her lip. "We have to follow protocol. Her oxygen is low, but it's above 85. She's alert. It's not considered emergent unless." Maya collapsed. Her eyes rolled back, and her body went limp in the chair. The nurse jumped. "Code Blue, get a crash cart." Vanessa dropped to her knees. Maya. Two more nurses appeared. A stretcher was rushed in. Maya's body was lifted. Vanessa tried to follow, but a security guard blocked her path. "You'll need to wait in the family area," he said gently. Vanessa couldn't hear him. She couldn't hear anything but the screaming inside her skull. Minutes dragged into eternity. The automatic doors stayed shut. No one came back out. She couldn't sit. She paced in tight circles. Her hand was shaking so hard she dropped her phone twice trying to call Denise, but she couldn't even form the words when the line picked up. She hung up, sat down, stood back up. Every nerve in her body was telling her to run inside, rip open those doors, and demand someone bring her daughter back. Finally, The doctor appeared. Vanessa ran to him. His face said everything. "We did everything we could," he began. "No. But by the time she was fully coded, no, we weren't able to revive her." Vanessa collapsed into the vinyl chair behind her, hands over her mouth. "No," she said again, softer now. "No, she was just breathing. I drove here." She walked in. "I'm so sorry," the doctor said. She stood up and slapped him across the face. The sound was small, controlled, but sharp. The security guard moved in. The nurse gasped. Vanessa didn't scream. She didn't shout. She stood there, staring at the man with hollow eyes. "She asked for help," she said quietly. "You all looked at her like she was wasting your time." The doctor didn't speak. Vanessa walked back to the chair and sat down. She didn't cry. Not then. Not when they offered condolences. Not when they handed her a bag with Maya's shoes in it. Not when they asked her to sign a paper about personal effects. She just kept whispering the same thing over and over. She was only 22. She just needed one person to listen. 3 days passed, but to Vanessa, it could have been 3 minutes or 3 months. Time didn't mean anything anymore. She sat in silence most of the day, half watching the shadows move across the walls of their apartment. The television stayed off. Her phone stayed charged but untouched. People from the church called. Her boss called. Denise stopped by twice. Vanessa didn't answer the door. She couldn't speak. Her voice had buried itself somewhere too deep to reach. Maya's things were still where she left them. Her school ID on the kitchen table. Her UNLV hoodie draped over the chair. A tote bag with flashcards inside. One of them reading pulmonary embolism, blockage of an artery in the lungs. Vanessa found it and dropped to her knees. It was the first time she sobbed. She had done everything she could, begged, borrowed, waited, pleaded with nurses, watched monitors, whispered prayers. And in the end, her daughter died in a building full of people who were trained to save lives. Not because they didn't know how, but because they didn't care to try. On the 4th day, Vanessa opened the door. She didn't know why. Maybe it was instinct. Maybe the quiet had finally started to rot. Denise was waiting there with a warm meal and a flyer for a grief support circle, but she also had something else, a name. There's a reporter asking about what happened to Maya. Denise said careful, slow. She's not a big name or anything, but she's local. Said she's done stories about the ER before. And she's black. Vanessa didn't react. She said her name's Aaliyah Mendez. She wants to talk. Just listen. Not twist anything. Vanessa took the paper with Aaliyah's number on it. She didn't promise anything. But she called. Aaliyah arrived the next morning. She didn't wear a press badge. She wore jeans, a t-shirt that read, "Say their names," and a solemn expression that said she'd been in too many rooms like this before. She didn't pull out a recorder or a notebook right away. She sat on the couch beside Vanessa and said, "I'm sorry. You don't have to tell me anything. But I'm here if you're ready." Vanessa didn't know if she was ready. But the silence had turned thick and sour in her throat, and something in Aaliyah's eyes reminded her of Maya. The way she listened, leaned in, let the moment belong to her. So she spoke. She told her everything. About the clinics, the expired insurance, the hospital staff who told her Maya was probably anxious, the nurse who told her to calm down, the doctor who walked away, the EMT who said, "Vitals are still stable." She told her about the seizure, the collapse, the look on Maya's face that final morning, like her body had given up before she did. Aaliyah didn't interrupt. She cried once, quietly, and wiped her eyes with her sleeve. When it was over, she asked permission to write the piece. Vanessa said yes. The article went up 2 days later. It was titled, "Her Oxygen Was 88. They called it stress." The subtitle read, "Maya Fields, a 22-year-old pre-med student, died after being denied care at multiple Las Vegas hospitals. Her mother begged them to help. No one listened." The article spread fast. At first, just through community networks, Black Twitter, local Facebook groups, medical bias forums. Then it hit larger platforms. Activists shared it. Organizers posted it. Nurses retweeted it with horror. One thread read, "Every black woman I know has a story like this. We're told we're dramatic. We're told we're fine. And then they blame us for not coming in sooner." Another said, "My little sister had similar symptoms. She almost died. Only difference? She had Blue Cross." Aaliyah did a follow-up article 3 days later. She named the hospitals. She filed Freedom of Information requests. She exposed that Sunrise Hospital had quietly settled 3 patient negligence claims in the past year, 2 of them involving young black women. Suddenly, everyone wanted a piece of the story. News stations called. Daytime shows emailed. A national magazine requested an interview. Vanessa ignored most of them. She didn't want attention. She wanted accountability. One night, she finally answered a call from an unknown number. It was Maya's biology professor from UNLV. He said, "I just wanted you to know, Maya was the best student I ever had. She should have made it. She would have been a great doctor." Vanessa said, "Thank you." Then she hung up and cried again. Aaliyah called the next day with a trembling voice. "They're not going to admit fault, Vanessa. The hospitals have all issued statements. You want to hear what they said?" Vanessa nodded. They said, "We are deeply saddened by the loss of Miss Fields and extend our condolences to her family. Due to HIPAA, we cannot comment on patient care. However, our staff followed protocol based on information available at the time." Vanessa didn't react. "Is that supposed to be an apology?" she asked. "No," Aaliyah said. "It's a shield." Later that week, Vanessa opened Maya's laptop and found a voice memo. It was dated just a few weeks before she died. Maya was practicing for a presentation. Her voice was clear, steady, confident. "The number one cause of preventable maternal death among black women in America is not biology. It's bias. If we want to fix that, we need more people who care. Not just in textbooks, in the ER, in triage, in real time." Vanessa replayed it over and over. That night, she called Aaliyah and said, "Let's not stop. Not until everyone hears her voice." Part 6, The Legacy She Left Behind. Vanessa stood in front of a folding table under a canvas tent in the corner of a grocery store parking lot. The air smelled like sun-warmed asphalt and fried onions from the taco truck nearby. A laminated banner flapped gently in the breeze behind her. It read, "The Maya Fields Project, Emergency Aid for Women of Color in Crisis." There were no television crews, no speeches, no ribbon to cut, just a few folding chairs, a stack of free blood pressure kits, and a clipboard with names. And yet, for the first time in months, Vanessa didn't feel powerless. She felt anchored. A young woman in scrubs approached the table and introduced herself as a nursing student from Nevada State. "I read the story," she said. "It changed everything for me." Vanessa nodded. She didn't cry this time. She was past tears now. What came after grief wasn't silence. It was motion, a kind of movement born from everything that could no longer be undone. The article Aaliyah had written kept circulating long after the major outlets moved on. Other mothers reached out, some private, some angry, some just broken. The comment sections became memorials for women who never made it to the front of the line. One mother wrote, "My daughter had the same symptoms, but we read Maya's story and I demanded tests. They found a clot just in time. She's alive because of you." Vanessa printed that comment out and taped it to the fridge. Not because it made anything better, but because it made something count. There was no lawsuit, no admission of guilt. The hospitals didn't lose funding or change policy. They offered a settlement behind closed doors, $5,000, and a page of legalese stating they bore no responsibility. Vanessa threw it in the trash without reading the second paragraph. What she did instead was show up. She and Aaliyah partnered with a group of community organizers. They raised enough money to start a small fund, $200 here, $300 there, just enough to cover a copay, a prescription, a bus ride across town to an urgent care that wouldn't ask too many questions. They printed resource flyers, translated them into Spanish, Tagalog, and Amharic. They hosted health workshops at beauty salons and barbershops. Aaliyah helped launch a podcast. Vanessa just spoke. Not like a politician, not like a victim, like a mother who had seen her child disappear in front of her and still decided to open the door to every stranger who knocked since. She never called herself an activist. She didn't want titles. But when she spoke, rooms went quiet. Something in her voice, low, steady, unflinching, carried more weight than anger ever could. Once, at a community roundtable, a hospital administrator tried to say, "We're doing our best." Vanessa leaned into the mic and replied, "Your best didn't include my daughter." The room went silent for a full 30 seconds. In her apartment, Maya's room stayed mostly the same. The textbooks were still on the shelf. The locket she wore every day now hung from the rearview mirror of Vanessa's car. And next to the door, taped to the wall, was the sticky note Maya had written months ago as a joke, stuck next to the light switch. It read, "Make today matter, even if it's small." Vanessa touched it every time she left the house. One Saturday morning, she visited a high school nursing program to speak to a class of teenagers who hadn't yet seen what hospitals could do to people like them. She told them about Maya, about the day she was told her oxygen was fine, about the clipboard, about the way even death could be processed like paperwork when the patient was black and uninsured. When she finished, a student raised her hand. "What do you want us to do? Like, what would you tell someone just starting out in healthcare?" Vanessa looked around the room. "Listen when we say it hurts," she said. "Believe us the first time. And remember that your charts, your protocols, your insurance policies, they're not more important than someone's child." The class applauded. Vanessa smiled softly, not because it felt triumphant, but because it felt real. Back at home, she sat at the kitchen table, a cup of tea in her hand, a stack of flyers beside her. Aaliyah called. "You've been quiet," she said. Vanessa looked at the window, where sunlight pooled across the floor. "I've been thinking about what comes next," she said. "Does it feel like closure?" "No," Vanessa replied. "It feels like a beginning Maya never got. So I'll keep going, as far as I can." They hung up. Vanessa stood, packed her tote bag, grabbed the keys, and kissed her fingers before tapping the locket on the mirror. Outside, the sun was rising. And though the world hadn't changed, not the hospitals, not the policies, not the machines that decided who lived and who didn't, Vanessa had. She wasn't waiting for justice anymore. She was building something better.